questions and answers about MLS laser therapy.
What is MLS Laser Therapy?
MLS laser therapy is a revolutionary treatment being used by doctors across the nation to relieve pain and reduce inflammation. One example, Dr. Richard Jacoby, one of America's leading foot and ankle surgeons, who has been using MLS laser therapy for 2 years.
It's a pretty amazing instrument. We call it the magic wand. A lot of patients come in who have had treatments for years, and they have instant relief of pain. If you wanted an alternative to medicine and surgery, a laser by far and beyond of any modality I've ever used in the physical therapy world, this is the best.
Other doctors have been similarly impressed.
I put myself under this laser the day after we got it. I did my shoulder and my knee, and that night I realized that I had no pain in my shoulder or knee after one treatment. It works.
How does it work?
The therapy laser employs 2 synchronized wavelengths of light, which transfer energy to damaged tissues at the cellular level.
That light triggers metabolic reactions in the cell that stimulate healing, that stimulate reduced inflammation, and stimulate pain reduction.
And after going through the different scientific studies, a lot of them out of Harvard, I was intrigued by the impact this light energy has on the cells. And to be able to decrease the inflammation pathway and the swelling on a cellular level, it makes sense that you thereby decrease the pain.
We brought it into our clinic and we started seeing patient after patient responding with almost too good to be true. You see someone that has such debilitating pain in 1-2 treatments and they're 80-90% better. So it's been really miraculous.
One of those miracle patients is Tony Gamby, who endured severe ankle pain for 8 years.
After the first 7-minute treatment, I was completely without pain. I was smiling all day long because I hadn't walked without pain in a long time. And to be without pain like this, it's worth every penny.
Who can benefit from MLS Laser Therapy?
The therapy is being used by podiatrists, pain management specialists, chiropractors, and other doctors. It has proven effective on a wide range of ailments, including tendon and ligament injuries, soft tissue injuries, muscle strains and tears, sore muscles and joints, degenerative joint conditions, neurological pain, chronic non-healing wounds, general pain, musculoskeletal disorders, pre- and post-surgical treatment, anti-inflammation applications, with new uses being found every day.
This is frankly the edge of a tidal wave. I think you're going to see within the next 5 years a significant shift in medicine towards utilization of this type of therapy for patients across the board, across specialties.
Even primary care doctors who may have a greater scope in their practice than just listening to the heart and lungs, but take on an actual treatment approach to the orthopedic or musculoskeletal arena. I see a tremendously broad application throughout the entire medical community.
What will I feel during the treatment?
You as a patient feel nothing. You don't feel warmth, you don't feel needles jabbing, you don't feel itching, you feel nothing. When I focus the machine shines a light, and then you get up and get dressed and you leave. And hopefully after that, you feel better.
Most important, what are the results?
Thousands of patients have tried laser therapy treatment with results that are almost uniformly positive. One example is Lisa Knott.
Hi, I'm here for my appointment today at 1 o'clock.
She has suffered from debilitating back and hip pain since high school.
The pain is absolutely immobilizing. I cannot, even at times, get out of bed.
After trying nearly everything else, Lisa recently began treatment with the MLS laser.
The same day that I have my treatment, I see significant results. My pain is definitely less, and I have more mobility.
There are similar stories across the country.
Even throwing a football, I can throw a football a lot better now than I could 2 years ago. Like, I'm so excited about it, and I tell everybody about it.
Even now, after several months, I have no pain in my knee.
It was like a mega dose of Advil and ice invisibly, and it was just amazing.
It was the second treatment, and I walked out of here and I knew that something was different. And I called him back up and I said, "Thanks a lot. I think there may be something to this."
In many cases, even veteran doctors have been amazed.
One of our staff members, she had plantar fasciitis and heel pain, and she had one treatment with the laser and helped her tremendously.
I've had just recently a patient come in with relatively acute swelling and tendonitis around her ankle joint. After one treatment, I was able to get about 95% of her symptoms resolved. And after 3 sessions, she was 99% resolved. And for a lot of patients, especially in our diabetic patients, this is almost too good to be true.
We've had patients after one treatment who said they can feel their foot for the first time. It's very impressive.
How many treatments will I need?
We are successfully treating young high school athletes with an acute ankle sprain that want to get back to sports sooner. And it looks like this laser treatment, after 3 treatments, 90% of their pain is gone, whereas it might have taken another 2 or 3 weeks. That's a lifetime to a 16-year-old who's about to miss half the football season.
If you're seeing some improvement within the first 3 treatments, I would definitely recommend that you continue on with treatment. For an acute condition, maybe 5 treatments will do the trick. For a longer chronic problem, as many as 10 treatments. Following that, it's reasonable to expect that you need some maintenance treatments down the road. But that's the initial protocol.
Is it possible that MLS laser therapy won't work for me?
There's always that chance, and nothing works for everything. And I don't ever promise anybody anything, but the results we've seen so far have been well over 70% responders.
What we're finding is 90% of our patients are achieving almost 90% relief of their symptoms, which is unheard of.
In the vast majority of cases across the country, MLS laser therapy has meant relief from often intractable pain, without medication, without surgery.
I had an injury that would be nagging for 6 to 9 months, would have taken a ton of ice, aspirin, rehab, and instead it was gone, and it was just amazing. So I became an instant believer in it.
After the first time, I felt the difference, and after the second time, it was an incredible difference.
The laser helped me at a critical time in healing when I was literally bedridden with back pain, and it was just relieving the pain.
Tell you what, it's done wonders. It's really done wonders for me, so I'm grateful for that.
I would say I'm about 70% better than I was prior to the laser.
After a few visits, I started to feel the difference. So I have to attribute the healing that took place to that treatment because I haven't had anything else done. That's it, simple as that.
It saved my life. It saved the ability for me to be able to be flexible and to walk and bicycle and to be a regular healthy person instead of somebody who was 64 and getting old and getting unflexible. And so it made a big difference to me. Very big difference.
We're now offering this new technology, non-invasive laser treatment, which has no side effects. There's no burning, no heat, no rashes, and these people are getting better. So in a sense, this has revolutionized my practice. Whereas I would have to say, throw up my hands and say, I'm sorry, there's nothing else I can offer you. We now have something to offer these patients. 90% of them are getting dramatically better.
This is probably the most transformative modality to come down the medical pathway in the last 50 years. It's that transformative.